A South African heart surgeon has been honored with an international award recognizing his work to save lives of children born with congenital heart disease. The founder of Young Hearts Africa, Dr. Wilhelm Lichtenberg, is a recipient of the Thoracic Surgery Foundation Every Heartbeat Matters Award. He joins us now for a further discussion on this. Firstly, congratulations on obtaining this award, Doc. Could you share with us a bit of your journey that led you to establish Young Hearts Africa and also the inspiration behind your work in saving the lives of children born with congenital heart disease?
Good afternoon, Nhlanhla. Thank you very much for the opportunity, and a happy Sunday to you and your listeners. You know, the question that you asked is fairly wide. I could keep you busy for many hours telling you the story behind it.
Yeah.
I will try and give you a proceed version.
Yeah.
First of all, the award really is the result of a concerted team effort of the people who have helped me to establish Young Hearts Africa Foundation. So it's their award, really. I'm not going to take the credit for it. But yes, as a junior trainee at Red Cross Children's Hospital more than 20 years ago, I recognized the need for a greater capacity to help people, indigent children in our country who do not have access to private health care and who are completely dependent on a dysfunctional and bankrupt public health care system. And it was on a Tuesday evening, I remember, where I had to go and tell a mother that her daughter had not made it through surgery and that she had to actually take this poor child back home to the Eastern Cape to bury her. I will never forget that mother's expression, and that's where the dream was born. And it's come a long way in a convoluted way, but we're very grateful that we have Young Hearts Africa established now and that we are able to try and whittle away at that waiting list to try and help these children.
So we've known you for being famously known as the singing surgeon, but being the only African recipient of this prestigious international award is truly remarkable. What do you believe sets your approach to humanitarian surgical outreach programs apart, particularly in addressing the challenges faced by indigent populations in underserved regions?
I think the advantage that we have is that we have an established infrastructure. We've launched our program at the Red Cross Children's Hospital, which is the accredited training hospital for the University of Cape Town, which already has an established program. And without taking away anything from the magnificent work that other humanitarian outreach projects are doing, they do have to fly in absolutely every single thing to the last alcohol swab twice a year, and the logistics and the costs involved are prohibitive. We devised a model where I realized we have the infrastructure, we just need to capacitate that maximally. And because of the fact that we have that, we also create opportunities in doing so to have material to train additional surgeons, anaesthetists, critical care specialists, nursing staff, technicians. So the one hand washes the other, and it's a continuum, whereas the fly-in missions, as fantastic as they are intermittent, and they don't offer that continuum. And for me, it's as much a question of helping these children as creating the opportunity for future generations to do that. Because as much as none of us can live forever, we can try and create a legacy which can be there long after we've gone. So it's all about creating infrastructure and creating capacity.
So let's speak more about the work of Young Hearts Africa. It's had a significant impact providing this life-saving surgery for 30 children with CHD so far. How do you see the themes of accessibility, affordability and quality of healthcare really resonating with the broader global health community, especially in the context of pediatric cardiac surgery?
Well, I've recently had the enormous advantage and privilege of attending the Every Heartbeat Matters Summit in California, where like-minded individuals from all the various different humanitarian outreach projects and organizations in North America attended, and we were able to exchange ideas and cross-pollinate. And what stood out for me was the fact that everybody faces the same problems, and we all have the same difficulties. And what became clear to me is that we need to defragment the work being done on the African continent and try and pull it all back into a central resource hub. These people have been doing this work for decades, and nobody wants to sacrifice their autonomy. But I do think that if we defragment it and we present a team approach and a full frontal approach on various different fronts throughout the African continent, we can just achieve so much more. So that's the other alleyway that I want to explore in the next few years, is to try and pull all these efforts together and see whether as a unit and as a team we can't achieve more than we are doing as individual units.
Dr. Lichtenberg, before we let you go, your efforts with Young Hearts Africa has undoubtedly evoked a range of emotions among your supporters and also beneficiaries of this program. What particular emotions do you hope your work and your story evoke, especially in the hearts of those who hear about it?
Hope, positivity, and a can-do attitude. Nelson Mandela once said, and that's the signature at the bottom of my email account because I truly believe it, he said, "It always seems impossible until it's done." And I had the advantage and the enormous privilege of meeting him and being his doctor for 2 weekends while he was on the campaign trail in 1994. And the impression that he made on me was enormous. And he said, "It always seems impossible until it's done." So impossible is a word that I don't believe exists other than in the vocabulary. And I think the hope that we can try and create with this work and showing that it can be done will resonate and permeate, and we can just go from strength to strength.
And on that note, for people who are looking to also get more information or support your cause as well, how do they get more information?
We have a website, and the web address is www.youngheartsafrica.org. All the information is on that website, the accessibility, all the links, everything you need to do to go and initiate your monthly contribution. And I want to say that again, initiate your monthly contribution is on that link, and we look forward to hearing from you and receiving your contributions.
Dr. Wilhelm Lichtenberg, thank you so much for joining us and really sharing your story as a humanitarian heart surgeon, but also the founder of Young Hearts Africa.